opportunity to this second day of the international webinar on social work intervention post COVID-19 situation with special reference to mental health. So I think all our faculty members have been connected. Our professor and head, Dr. Mangleshwaran, is connected with us, and our professor and chair of social science, Dr. Ilango, I think he has been connected. My teacher and my colleagues, Dr. Nirmala and Dr. Rajwel, is also connected with us. And yesterday, our professor and head, Dr. Mangleshwaran, said about the department's activities and its achievement. Adding to that, I would like to say a few words about the MOUs. The Department of Social Work has 4 MOUs. I'm telling it chronologically. The Department of Social Work has MOU with James Cook University for about 10 years, and with Hovest University, Belgium, for about 5 years, and with the Heritage Foundation that works for geriatric care, Hyderabad, for about 5 years, and the MOU with University West with Linnaeus Palme teacher-student exchange program is the youngest MOU that the Department of Social Work has entered into. And I'm so happy to say that 2 of our students, Mr. Pradeep and Mr. Gopinath, is there in Sweden, in Trollhättan. They are amidst the COVID-19 pandemic. They are safe over there. And the University West teachers, Professor Mari, Professor Christine, and Professor Annette, and others in the department are just giving them good support over there. And shortly they will be back to India also. So this time, Dr. Rajwel is supposed to have visited University West, but unfortunately, because of this COVID issue, he was not able to be there. Maybe this is postponed. That's what I heard from University West too. So this is about some MOUs that our department is having, and yesterday's session was a wonderful session, and we had a speaker from James Cook University, Australia, Professor Abraham Francis. He's from Associate Professor and Head, Social Work and Human Services, and that was a wonderful reflective session. And today we have 3 speakers, 3 ladies from University West, professors, and I'll be happy to invite them to this webinar too. And it was done in a very short notice, and I'm so happy that all 3 of you are present here and that gives a lot of credit to the department, and we are happy as a Department of Social Work. We thank you for that. And this COVID-19 pandemic has made us to think different, because even after this lockdown, and what is going to be the situation after lockdown, and how are we going to fight against this invisible agent that is affecting us worldwide? Most of us know this, maybe all of us know that it has shook the whole country, maybe more than 227 countries, and affected lakhs and lakhs and killed lakhs and lakhs of people. So it is a serious pandemic that all of us are talking about. But I should say that Sweden is combating it in a different way. That is what I heard it from Christina when we have a Skype meeting. So I think she will share about it. And so with these few words of welcoming and introduction, I now request Professor Mari. Before that, I have to say a few words or tell about Mari Westerlin. Professor Mari Westerlin is working in the Department of Social Work and Social Pedagogy. And she has done her PhD in education with specialization work, integrated learning. And her areas of research areas are concerned with professional knowledge and learning. So happy to meet you, Professor Mari. And maybe you can present your over to Mari.
Thank you. And thank you for the invitation to participate in this webinar. And it's a privilege for me and my colleagues Christina, or Stina as we call her, and Annette to be able to join you. And we, in the beginning here, we will start to, all of us will give together a short view of the strategies used in Sweden, and then we'll just give some more information about mental health, young people, children and young people, and elderly people. But I will try to share a PowerPoint presentation that I have.
Yes, you can share. You can share. You can?
Yes. I shall see if I present now. I guess I shall try to find it.
Shall I help you to do that from here?
Yes, please.
Yes. Sir, Mangal sir, can you do that? It has been shared by from our department. Professor is doing that. Mari, you can proceed. The screen is.
Okay. Yes, we start to give a short presentation of Sweden and what kind of country this is. We have because I think it differs a lot from India. The population is 10.3 millions, and 2 millions are under the age of 18 years, and 1.5 millions are over the age of 70 years. And of all these people, 85% live in the cities, and 15% of Swedes were born in another country. And as you can see on the map, you can see that what is colored in green in the highest up there, green, we see EU countries, and you find Sweden as a very long country up there. And you can see, if you can see the map of just Sweden, the University West, we are close to what is called Gothenburg in the west coast, more or less in the south. Myself, I come from the north, from Umeå, and it's about 1,000 kilometers between Gothenburg and Umeå, so that you see more or less how big the country is. And it's smaller than India. But less than 3% of Sweden's land are built up, and forests cover 69% of the country. So you can imagine that Sweden is a country with a lot of nature, a lot of forests, and people can live, if they don't live in the city, live in the countryside, they can live with much distance between one another. I leave the word now to Annette to continue with the strategy of Sweden.
Okay, hello everyone. My name is Annette, and I'm absolutely delighted to have been invited to do this webinar, and it's a great honor to be able to talk about the Swedish strategy. I hope you can all hear me fine.
Yes, but your audio is not, your video is not visible, Annette.
My video is not visible.
Yeah.
Okay. Can you see me now? No?
Not yet.
Not yet. Okay. Maybe I just talk then, and you can still not see me?
Yes. No. Yes.
You can see me now?
No.
Okay. So, well, maybe I can just talk to this picture, and then I try to fix it.
Yeah.
Anyway, the strategy in Sweden is the main strategy is, of course, to eliminate, or rather control, the COVID-19. And on the 1st of February, the government classified COVID-19 as a disease that constitutes a danger to society, which we've written on this PowerPoint. And now something disappeared from me. Okay. Marie, maybe you can take over, as I seem to have some digital problems. I can't see the...
But
Yes.
no one can see the PowerPoint
Yeah.
pictures
Okay,
right now.
all right. Well, I can continue talking then. And basically, the measures the government have taken is trying to reduce the pace of the virus spread. And in particular, one important thing is that they are trying to reduce the virus, but together with an ambition which is looking at, they're weighing it up towards the effects on society and public health in general. So they are quite anxious to both handle the virus, but at the same time, society as whole should also not be affected too much, or they are not prepared to control the virus on the cost of the whole of the society's well-being. And that is maybe the answer towards why Sweden, compared to other countries, adopted a strategy which appears from the outside to be a bit more open. And one of the main messages to the society is that what we can do to prevent transmission is that everyone will take responsibility in solidarity with vulnerable groups. It's a strong emphasis on recommendations rather than strict rules. And the first recommendation, which is the main thing they're pushing out, is strengthen the hygiene. That is number one recommendation, is, together with keeping distance. And some of the consequences are that most people who can should work from home. You should avoid public transport, avoid unnecessary travel, including traveling abroad, which I think is similar to India. And also that not more than 50 people can meet, gather together. All elementary schools are open, which is a difference to most of the European countries. So all our young children up until 16 have been able to continue their schooling, which has also enabled people to go to work because their children are in school, if they have to go to work or work at home. Although the upper secondary school has been closed. And I was talking about that they're trying not to use legislation, but there is one area where they have implemented some legislation, and is concerning restaurants and bars and cafes. There are they able to close down these ones if they are allowing people to be if the restaurants are allowing people to visits in mass. So basically, this tragedy has led to quite a few numbers of deaths, but in particular with the elderly group of the society in Sweden, which Stina will talk about more about this. But also, at the moment, the amount of people who are dying of the disease is declining, and although the virus is spreading in the whole of the country. So thank you, and I will try to fix my camera so I can show you in picture as well. So I leave for Marie to do it now. Thank you.
So before that, I have to just talk about introduce Christina and Annette Dibolin. So Professor Annette Dibolin is a professor in social work and social pedagogy, and she is working in the area of children and parents, and she has done her postdoc project on children and adolescents experiences and understanding of parents, unemployment, and focused on parents' deteriorating household finances and impact on children and young people. So Annette Dibolin has good experience in the area of children and adolescents, and she has worked a lot. And about our another speaker, Professor Christina Pearson. She also works as a lecturer in the Department of Social Work and Social Pedagogy, University West, and she has basically a management sociologist. And later she did her master's in social work. And before that, she has worked as an investigator at the Swedish Social Insurance Agency, a social security unit manager for personal assistance, and psychiatric counselor also. So over to Marie to proceed.
Yeah, thank you. Just turning back to the other slide there, you saw, as Annette was talking about, the personal responsibility is emphasized in Sweden. That and to follow the authorities' advice. If you have even the slightest symptoms, do not go to work and refrain from meeting other people. That is the personal responsibility. And in Sweden, I think that should be noted also, that we have a culture of that people have a high level of trust in government agencies. And this means that the large portion of people follow government agencies' advice. And in the whole, I should say that people act with responsibility, but it starts to get a hard time now with the springtime, and the summer is coming, and people are tired of being in isolation from one another. And the curve you could see below, it shows the rate of the numbers of people that have died each day in March, from 1st of March to the 8th of May. Compared to the same time during the years of 2015 and 19. And we could see that there is a peak in April there. But if I continue to, I don't know if you want to say something more about that, Annette?
Yes, I would like to say something more, and I hope that you can see me now. I can see myself in the picture. So, hello everybody. Yes. So now I just wanted to say hello, and I'm with you now in the picture. So you can continue, Marie.
Okay. Yeah, I will continue with the mental health. And the picture you see there, that is just to show how it looks in the European countries. And you can see that 1 in 6 people in these countries have a mental health problem. And Sweden is, it's more or less the same as everyone else. It says 18.3%. And I guess this is interesting if you compare, we can see what happens in some years, because many researchers and people, they think there is a major risk for mental illness during this corona crisis. And I guess this seminar is also just putting the light on that. And in Sweden, according to a report from the Center for Epidemiology and Social Medicine, it's a hard word, I don't know. They have made a report, and according to that report, they find that there are many people that and especially caregivers and people who are taking intensive care for coronavirus, COVID-19, are at high risk for impaired mental health. And they also think that they are worried about that many of them are expecting also to have post-traumatic stress syndrome after this pandemic is over, because this is what they can see in studies about similar pandemics that has been, what happens to people. But this also is the same with patients that has been taken care of with acute respiratory failure, that they also have this PTSD syndromes, and they have it a long time after they get out from the hospital also. So this is a big worry that we have. And they also are worried that it's likely that violence against children, depression, anxiety in the population will increase during this pandemic. And that could be connected to economic crisis in the wake of the pandemic in many ways. Another thing that is special for I don't know if it's just special for Sweden, but anyhow, in Sweden, we have, it seems like many foreign-born people, they are more affected by COVID-19 than other parts of the population. And it's interesting that many of these people also suffer. They are overrepresented concerning the post-traumatic stress syndrome. So you could expect that it could be, it's a high risk for long-term consequences for this group of people. And there you also have the language barrier that might make it more complicated when they are taken care of also at the hospitals and so on. So long-time consequences, there are, for example, fatigue, memory disorder, and depression, and a lot of things. And I'm sure you talked about a lot of these things yesterday also. But if you see in the other picture, the picture before, you could see some concrete things that happens in the practices that work with people with mental health problems. And we can see in Sweden that clinics just receive patients with serious problem with mental health. There are plans for special departments for COVID-19 infected patients. But there are also a lot of ethical dilemmas connected to, in Sweden we have this compulsory care for some of the people, but there might be risks to put people in hospital also. So there are a lot of ethical dilemmas that they have to consider during this time. But following this, we are also trying to increase the care in the home of the patients. But it also means that all the work to follow up and group treatments are adjusted or they are paused, so they don't do it. It has to wait for later. And we have these adjustments to telephone and digitized solutions. But also here we see a lot of considerations that has to be made, because when working with clients or patients online, the social worker need to be very sure that the client and patient is safe at home. And if you have this kind of worries about increased violence in the home, in family relations, and if there are issues of mental health, I mean that it's really important that the social worker and the person that there can be a guarantee that the person is safe. Because otherwise it will be very hard with digitized solutions. And I think they try to make other kind of meetings possible when that's in serious cases. We can also see that fewer people seek help for their mental health. And people often cancel meetings. And this is also a great worry, because people that are ill, they risk of becoming even more ill with all the worries that there is with during these times. But they can see that fewer people seek help. And I heard that news yesterday, not about the mental health, but in the healthcare and cancer patients, they can also see that less number of people seek help at the hospital because of the corona. So there are a lot of risks, and we don't know all consequences yet, but the healthcare, they want people to continue to connect hospital and say that we they can help them. But of course, in Sweden, and as I guess in the rest of the world, there are a lot of research projects related to COVID-19. And in Sweden, for example, they are starting a project about patients with serious psychiatric diagnosis, such as psychosis and bipolar disease. So, and I guess it's a lot of things going on. But to continue with consequences, these reports, they also show that work is a factor that related to mental health, as well as economy. And as you know, the COVID-19 has rapidly changed the labor market. And here in Sweden, we can see that some employers have to notify notice or make use of layoffs and short-term work, while other employers have received an increased recruitment need, such as healthcare. And people are retrained because they need more people there. In Sweden, we have something called the Swedish Public Employment Service, and there you can find information in many different languages about how job seekers are affected by the coronavirus, but also about the possibilities to find jobs related to, for example, healthcare, where they really need people. You can see there in the PowerPoint there is a link that you can read about this also in English, I guess, if you're interested. But another factor related to work is the economy. And for many, I think we could change the picture. For many, the coronavirus is causing money issues due, for example, that they don't have work anymore, or that they have a lower income. They don't work as much as before. I, for example, have a cousin, he works 1 day a week instead of 5 days a week. So they handle it in different ways. But in a report, it's shown that the socio-economical vulnerable groups, they suffer more than other people. They're affected to a greater extent than the rest of the population, and inequalities in health that already exist tend to increase both in short and in long term. And I think here we have a very big challenge, talking about the future and what will happen. A challenge right now when things are happening, but also looking forward. But of course, the social service, they have to continue their work, and they have to continue with supporting, giving social assistance and economic support, and help people with budgets and debt counseling. So that part is continuing. We have the Swedish Tax Agency that gives information to business and employers, because they are also trying to make it easier as employers to economical, so that they can keep people at work as far as possible, and give support, so they don't, since all these things are so related to one another. So I think the government also are very focused on trying to support and propose. There are additional funding proposed to municipalities and regions to be able to maintain their work, not just this year but also coming years. I think I leave the word now to Annette to continue.
Okay, thank you, Marie. That's very kind of you. And my research area is children and young people, foremost how we organize support for children and young people in social services. And at the moment, as Marie said, the research around COVID-19 and children and young people is of course non-existent, but there's a lot of projects who are planned and started up. But basically the government's guidelines, the consequences for children and young people's services is the restriction of physical contact. And in service centers, for example, for children and young people and families, they have posters saying, do not come into the building. The social workers have restrictions around doing home visits, and also there are restrictions towards booking meetings in the clinics. And if they are going to meet children and young people and families, they need to consult with a manager. So in that sense, their discretion has been cut a little bit. And the recommendation is to have contact through digital devices or by phone. And also, if possible, the social worker should work from home. I was talking to a social worker the other day who was sitting at home trying to arrange contact through digital devices with clients, and who felt it was quite demanding and difficult. And also, if you do work from the office, they have guidelines that you should always bring your computer home so that you can work from home if you have any symptoms of the virus. And I have also put on the PowerPoint to the left, there are 3 governing bodies who are giving out guidelines to the Children and Family Services, which is our National Board of Health and Welfare, which is on the national level. And we also have 21 regions who are on the regional level and responsible for a health service, and then you have 290 local authorities, but you also have a lot of NGOs, church, mosques, social networks, and they are all involved in trying to provide support for children and young people in Sweden in different ways. And they are all trying to do this at the moment without having any kind of physical contact with young people, which of course makes it difficult in how to communicate and how to maybe read behind what children are saying about their situation. What you also have social workers report is that they feel that having contact with the children and the families with digital devices kind of affects their opportunity to build a rapport, to build trust, to be able to read what the people might want to convey, in particular children. So they're a bit worried about the future contact with the children and the families. And they also notice that some parents and also some young people, not the small ones, kind of use the situation to decline contact. There might be a family who the social workers have tried to engage in work, and now they are very happy to say that they are scared to meet or they are scared to have contact because of the virus. They have also noticed all over the country that there are fewer referrals from schools. Even though the school is open for the younger ones under 16, there are still less referrals from school personnel about children at risk. And also they have noticed that some families keep their children at home, and there have been some instances where the head teacher in schools had contacted the parents and tell them you have to send the child to school because school is compulsory for children up to 16, because they kept the child home for weeks because they are scared that the child would bring the virus home to the family. In Sweden, they have also noticed an increase in the use of the child helpline, and the child helpline are at the moment trying to to start to use IE like a robot to be able to respond to calls and have some standardized answers around COVID-19 worries. We also have, as I said, research going on, and some of the fears are that there will be an increase, like Marie said, on violence at home when people are living in cramped housing and parents have become unemployed and there are more stress on the family. But there are also stories about children who report that they're happier because the parents are home more and that they like that the parents are, that the family are more together and that they are not sort of doing a lot of other things, which means that the parents are away more. So we will hopefully see both. There might be an increase of mental health problems, but there also might be a decrease of mental health problem, in particularly more kind of middle class, high performing families who might not have spent so much time at home with the parents. And this is, I find very interesting because I did some research after the financial crisis 2008, 2009, and I interviewed many young people what it was like when their parents become unemployed. Some of the children, it's about 47 of them, also reported that there was a kind of a benefit with having parents unemployed in the sense that they felt that they could spend more time with them, although they also realized that there was more difficult with the income and being able to the parents were suffering from the unemployment. And I will just move on to the next picture. Thank you for guiding me so we don't use too much time. And the young people in Sweden are maybe much more affected than the younger people in the sense that the upper secondary school are having online education, and in particular it's been noticed that young people who are in need of special support, educational special support, are suffering. And there's a lot of great risk for, in particular, these young people. They might not be able to get their exam to reach the grades they need. And they who are born 2003 in Sweden are extremely vulnerable with regards to the employment market as well, because they are the one who are going out for finding work now. I would say that's probably the main concern for social workers at the moment, is this whole group of young people who are leaving upper secondary school now. And of course they are also affected with that you can't do any visits to elderly care homes, you can't visit grandparents, and also this that you're not allowed to have indoor parties, and young people in Sweden like to enjoy themselves going to parties, but you can have outdoor parties. And I have a picture here with young people in hats, and it's in Sweden in June. All young people who are born 2003 who are doing their final exams also celebrate this, and this is a big happening in Sweden, and it's all been cancelled. And of course there's also kind of initiation custom into the adult world is to have this like big party entering into the adulthood. What I didn't say with the young people, all sports have been allowed. We have been allowed to do football training. Young people have been allowed to play together in playgrounds, and this is also for the younger ones and the older ones. I think this is what I wanted to say around children and young people, and please send in questions if you have. Thank you. So, Stina, can you take over?
I can take over.
I forgot.
You have to say something about drugs.
Yes. That was my area. I will do this quite quickly in the sense that basically the main effect in Sweden with regards to addiction and alcohol and drugs is that there are a shortage of drugs. So the people who have drug addictions, they have noticed an increase of the price of the drugs, and people are taking greater risk to get the drugs. And also the clinics are closed and they're not allowed to have physical contact. And they have also noticed that more people are trying to get onto the programs with substitute programs because of the shortage of the drugs. So they want to have the legal drugs. But of course the clinics are closed down, so they can't come to get the legal drugs. And with regard to alcohol, there has been an increase in the sale of alcohol. And there are increase of support programs with digital tools, but the drop-in clinics have closed down. So people are typically using more alcohol. But at the same time, we also used to buy a lot of alcohol in our neighbor countries, so they don't really know if the increase is just due to people using more alcohol, or is it because they cannot buy alcohol in, for example, Germany and Denmark, which are something we're used to do. So, thank you. We can take the next picture now, and then Stina will take over.
So my name is Stina, and it's a great honor for me and my colleagues to take part in this webinar. I'm going to say something about a person with disabilities and elderly care, and also finish with students' experience from practical studies in the field. So you can change the picture. So, and I want to say, like Annette and Marie says, that many social workers works at home this day. And I recently this morning talked to a lady working in Stockholm, and she said that when she was interviewing old people over their needs, she had to call them by phone, and it is a problem. And I also want to say something about the legislation, because in Sweden we have in social legislation we have two laws in picture. So we will start with the people, because when I prepared this I searched and found out that a lot of people have died in middle, but not so much like old people. So the number of people who died in COVID-19 was 26 people who had a sub-project according to LSS. This is one of the laws. So it's to people with disabilities. And look at the service for people with disabilities is that they have most of their regular services is cancelled, and social workers are meeting them by phone or by video calls. So of course it's very tragic that people are dying, but it seems to work better for people with disabilities in Sweden. So you can change a picture. So now I'm going to say something about elderly care, because in Sweden elderly care also is social work, organized different in different countries. But in Sweden, social work is elderly care is in social work. So the municipalities have the main responsibility for the elderly care, including the activities carried out within the home service and in special housing. Most common service is home care, and service and personal care is performed in the elderly person's home. So in home, social workers are coming home to old people to help them. And in Sweden, we don't live together as a family, so people live by themselves. So you need to know that. And then when you're old, you can also get special housing. and this is when you need care day and night. So, and the regulation, like Annette and Marie told in the start, is that you cannot visit elderly care homes, and all people about 70 years are strongly recommended to keep physical distance. So they have to stay at home. Even though if you are healthy, you have to stay at home. You can go outside to take a walk, and you can go outside to meet friends and talk to them, but you need to keep a distance. So when you talk about social work, there's also social work not performed by the municipality. It's also volunteers. So Sweden now have an increased volunteer social work. So for example, the church. So maybe this is an explanation that many old people was infected. And also Marta says that it has to do with how the virus was spread in Italy. The infection entered to the hospital. So in Sweden we thought beginning to save people and take care of it in the hospital. And there was putting a lot of effort in the hospital, but then missed that the very old people and living nursing homes and in home, actually in their own home in Swedish elderly care. So we will see, but how this will continue. So now I want to finish this because we have 2 Indian students in Sweden. And their visit in Sweden has been quite unusual. So this is the first reflection. I told them to please write something down, and you can write it by yourself, because now they have to have their studies online. And you can change to the other picture. And this is the other student, and of course Swedish people are not famous for socializing. We like sitting at home most, but this is even worse in COVID-19. So it's been very interesting for them, but also kind of scary, I think. But they cope on well. Yeah. So you can change to the next picture. So this is the Swedish students, because our Swedish students are doing the practical studies in the field. So she says she's talking about what she had learned in this situation. Because they started when there was no COVID-19 or just a little, and then it just increased. So, but most of them they can continue to do their practical studies in the field. And you can take the next picture. So this is a student. She says something about the current situation, but she also says something about social work, and very, very wise. She says social work is important in ordinary cases, but perhaps even more important under prevailing circumstances. This is how during the pandemic that affect us all in different ways. I have had an excellent opportunity to learn more than I might have done in normal cases. So we talk to our students and saying to them, social work is more important now than ever. So I think this was my last slide. Yes?
Yes, if that is over, maybe some questions have come in the chat box, and so maybe any one of you can answer or give them a little bit of clarification regarding that questions. So shall I call it out? Is Marie with us also? I could see still Timolin.
Yes, okay. I'm here, and Marie is.
Yeah. So do you think one of the participants asked a question like, do you think elderly are more affected in Sweden? That was the question.
Yes.
Yes. And, I think, just say that I think it's important to understand that of all people who have died in Sweden, 90% are above 70. And of those 90%, I think it's more than 67% are within elderly care, either in a house or receiving elderly care home services. So of course, but we also need to recognize that in Sweden, if you go into an elderly care home, you are often so poor, sick in a way, so you often just stay there for maybe a year.
Yeah.
So you don't live there long term. So they are very, very ill people. So they are, when the virus enters the elderly care home, many old people are dying, basically, which is the same when we have the ordinary flu too. So it's looking back, we will definitely, and also I would just say that most of the people have lived in Stockholm area because that's the hardest hit, and also the workforce in elderly care in Stockholm area is different from the workforce in the smaller towns, because in Stockholm area I think it's 40% of the workforce are not permanently employed. They're just kind of employed by the hour. So of course they need to go to work, even though if they might feel a little bit, not 100%. So it's kind of a complex elderly care situation which have become in the view at the moment.
Yes, and more questions have come related to the field of elderly. And one participant has asked that what are the ideas to be followed to increase the immunity of elderly people? And that was a question by one of the participants.
Can you repeat the question?
What are the ideas followed to increase the immunity of elderly in Sweden?
Well, okay, I can answer too, in the sense that I know that there are a lot of thoughts on actually nutrition in elderly care. We have some problems with undernourishment due to the quality of the elderly care. So movements in having a better plan for nutrition in the elderly care would be one of the measures to take to increase the immunity. And I think that's nutrition and also physical activity. So, but we have to remember that they are very, very poorly, the people in the elderly care, most people stay at home as long as possible. So it's really the last resort.
So another participant has asked that how can we protect the disease of HIV, tuberculosis and other cancer from COVID-19, and can you give suggestions? How can you protect these people? So that was a question asked. And Dr. Ilaga, would you like to say something?
Yeah, sure. Are they going to address that question, Jerida?
Maybe you finish it and let them take it up.
Okay, yeah, sure. Thank you, Jerida, for inviting me to join and to share my views. And first of all, I must congratulate and greet all these speakers today, Mary, Annette, and Christina. Am I right? I hope I got the names correct. Yes. So really very informative and thought-provoking presentations. I'm so pleased to see you all and to listen to you. And I think Mary gave a fantastic overview of the macro level government initiatives in Sweden, which was wonderful. I could understand the policy and the strategies being adopted by the Swedish government in this pandemic situation. It was very informative. And from Annette's presentation, one of the important things which really struck me was the issues related to alcohol. She was talking about the alcohol, consumption and issues related to that. The bars being open and how people get affected by that. I think that's a similar issue which has also been, affecting us in India, especially in this part of India where we live in our state. We had a huge problem related to, the alcohol, because the government opened the liquor shop.
Mm-hmm. Mm.
It is not audible, sir. There is a break in your voice. Can you repeat it?
Yeah.
There is a break in your voice. No, sir, not it. Not it. Not it. There is a break.
Let Dr. Jarita, let the
Yes, sir.
questions be answered. And so can join later.
Okay. Sir, your audio is not proper, so shall we take the question, your presentation, your answering later? Yeah.
Yeah, you can proceed.
And then stop it. It's a bit what's wrong with it.
Audio is not clear, sir. You'd be later after the answer, you can take it up, sir.
Please, madam.
Yes, this question I was in the chat box, like how the people affected with HIV, tuberculosis and cancer are able to cope up with this COVID virus. This was a question that was there in the chat box, and particularly in Sweden, how people are able to cope up with it.
Well, shall I answer?
Yes.
Yes, I think we can say that people with HIV or people who are affected by cancer are quite strongly affected in the sense that there are a mobilization of all the resources in hospital care towards the COVID-19 treatment, which means that they have closed down or postponed a lot of regular checkups. But if there are if that's one thing, but also if you are in active cancer treatment, for example, with radiation treatment or tablet treatment, you are also in the risk group, so you need to keep yourself isolated. And of course, there is a risk if you need to go to the hospital for treatment. But of course, they adopt all the hygiene rules. But in particular, they expect that there will be an increase in cancer cases which would have been discovered earlier on. And the HIV and AIDS patients are affected in the same way as other patients who are in treatment, in that we will have to pick it up later on, I'd say.
Yes, thank you. And let this be the final question to the speakers of today. One participant has asked is, how is Sweden different from other countries in dealing with COVID-19? Maybe you just shared it in your PPT also, so maybe the participant wanted more specific too.
All the restaurants and shops are open and we don't have any lockdown. But so it's not so different, but and we need to take a lot of responsible by ourselves.
But I think I just want to emphasize that there is, like Marie said, a tradition of having trust in the government. So when the government asks us to do social distancing, majority of the people are following it. What do you say?
We have to do.
Marie, didn't you?
No, I know it's okay.
No, please.
Annette, I think Annette said it, and just to complete maybe with something that they also believe that this when the physical isolation is for, I mean, you choose it, you take responsibility for it. It has not so much not so much negative consequences on the mental health than it could have when it is forced upon you. So this is something that they say in Sweden also, the experts, or what you could say. So I think that is also one of the arguments.
But also the government was very clear in the beginning that we need to put in measurements who are long term. They need to be sustainable. So people need to take responsibility, but they also need to have the opportunity to take responsibility, so that we cannot have too harsh restrictions, because then it's not sustainable. And I think that's been one of the key messages for the people.
Yeah. And I think Professor Ilango want to share something, just a few words from him. Yeah.
Yes. Can you hear me now, Girida?
Yes, sir, we can hear you, sir.
Okay. I'm not sure up to which point you were able to hear me, because I was referring to Mary's talk on the government policies and strategies and the interventions of the Swedish government, which was very informative. And from Annette's presentation, one of the important issues which I found was the issues related to alcohol, alcohol use, and also the bars being open and how people are affected during this time. So that's a very similar issue, I think, which we are also struggling with in India, especially in our state. We have seen some, issues related to that. And from Christina's presentation, as a gerontologist myself, I'm more interested in the field of aging. So I found a lot of very informative, ideas, informative thoughts from Christina's presentation on the elderly care in Sweden. And it's really shocking to hear the kind of, the death rate among the elderly. It's so high, and also to know that the majority of the deaths are happening in the aged care homes, which is really a worrisome factor. But I think Swedish government is dealing with it very well, and as after listening to you all, I understand that very effective strategies are being followed. And one important thing I find in Sweden, social workers are recognized. Social workers are considered as very important, professionals who can, contribute during this pandemic situation. In that aspect, that's what that's the main takeaway point from all the three presentations. And thank you very much, Mary, Annette, and Christina, for sharing your valuable thoughts and information. Thank you. Wonderful.
Thank you.
All. Thank you so much.
Thank you, thank you, sir. So maybe now I will just call upon Dr. Nirmala to just consolidate this session, and then she will hand it over to our professor and head, Dr. Mangleshwaran, for the final thing. Thank you so much for the speakers.
Thank you.
Thank you. Thank you, Rita.
Yeah.
Thank you. So, first of all, greetings to each and every one of you. It is very nice listening to all the three speakers from University West Sweden. We have had speakers Dr. Marie Westerlin, head of the department, and Dr. Annette Bolin, professor in social work, and Mrs. Tina Persson, lecturer in social work. So we all know that COVID-19 had created a lot of crises socially, economically, politically, psychologically, all over the world. So this international webinar had brought to the participants the international level eminent speakers to know about what is the situation in a developed country. Here we are living in developing country. What is the situation going on here? We are able to learn from various sources like newspapers, television, WhatsApp, Twitter, Telegram. So through various sources we are getting information. So yesterday and today we have got the clear picture of what is happening in a developed country. So very beautifully, very clearly it was presented all the three speakers. So a few points I would like to quote, which is told by each speaker, starting with Dr. Marie Westerlin. Marie Westerlin, it was a very nice presentation. It went on well. Started with giving the statistical information. So usually when people from Sweden, when they talk about any topic, they'll be very accurate, very specific in things, and they will speak statistically. Don't know how it is, because whether we are in an overpopulated country, we are not able to tell like that. But the Swedish people, they'll be very clear in telling every information statistically. So in that manner, today also the program started with statistical information only, and also took us to Sweden to the map. So clearly explained, and Marie was explaining to us that 1 in 6 person has a mental health problem in European countries, and the effects of COVID-19 was very clearly explained, and it was also highlighted that post-traumatic stress disorder may come up after this COVID-19. So due to the crisis people have undergone during these stages at the COVID-19 period, there are possibility to see an increase in PTSD, and also anxiety is higher among the people. It was highlighted by Marie. So here also in India, we can see 2 days back when we had the program, one of our senior professor also told that it is anxiety is higher here, and also the other psychological problems are there, and also told that ethical dilemmas they have in Sweden, and the social worker must make sure that whether their clients are getting well, whether they are coming up well, and certain similarities we are able to find out with all the three presenters, that there are less number of people seek help in hospital due to this coronavirus. During this COVID-19 period, even here in India, people are not allowed to go to the hospital whenever they wanted to go due to lockdown and due to the coronavirus spread. They were asked to stay at home only. So the same we had, and also she highlighted that research projects are coming up. The same situation we can find in India also. And after Marie's presentation, we had Annette presentation. That was also very nice. She was highlighting what sort of problems the children and adolescents are facing, and also she explained about the measures which the government is insisted, and what are the recommendations made. So when we see what is insisted in Sweden, more or less the same we have, that is maintaining social distancing and not mingling with other people. We have to keep ourselves safe. So everything we can see the similarity, and also highlighted that they can go for sports activities. The children, the adults, they are allowed to go for sports activities. They can involve in training activities and outdoor activities. That is not found here in India. The restrictions are there. And very beautifully, statistically also, she explained the issues related to alcohol. And coming to the last speaker, Mrs. Tina Persson, and her presentation also, she highlighted the laws, specifically laws related to the aged and also with the disabilities. And it is really paining to hear that elderly people are much affected, and they have died in Sweden, and most of the people are aged people only, those who have died due to this problem. And also Stina presented the students' experiences. That also gave an idea for us. And at the last question which was raised by one of the participants also was very much interesting. Asking for the differences between Sweden and other countries, and very beautifully answered by Stina, saying that individual responsibility is very important. That is important for wherever people, whichever country people belong to. Individual responsibility is more important. That is what we have come to a conclusion. There are positives, there are similarities and differences also. But one thing we should remember from the COVID-19, that how many days, that is pre or post-COVID period, our individual responsibilities are more important. So through that only we can fight against COVID-19. So all the 3 lectures are very much thought-provoking, very clear presentation, and it was very much natural also. It was very nice listening to all the 3 presenters. So I thank my head of the department and our senior professor, Dr. Ilango, for giving me the opportunity to give the concluding remarks for all the 3 eminent speakers from Sweden. Thank you so much.
Thank you, Dr. Nirmala. So we could just visualize that self-care strategies are very important for handling post-COVID situation. So over to Professor and Head Dr. Mangleshwaran for his final remarks.
Okay. So thank you very much, Dr. Jirida, Dr. Nirmala, for taking up the session in a very effective manner. And also I should also thank Professor Ilango. And I also joined with my faculty members in wishing and thanking a very wonderful presentation by the 3 eminent social work faculties from the University of West Sweden, Dr. Mary, Annette, and Stina. So that was a really interesting webinar, I hope so, because the last 2 days has given a wide spectrum, a wide knowledge on how to go about the social work education. So how we can able to take up the social work education, because it's quite challenging. I would say that it is quite challenging for the social workers to take up the further more after the post-COVID situation, because the role of social workers are getting more strengthened, and they are going to play a very, very vital role in the society. And as we are right now doing, as all the social work fraternity all over the globe are joining together in spite of lockdown in our country, and still we are trying to do a justice for the social work profession. And perhaps that was as Nirmala and Dr. Ilango sir has really consolidated well about the situations. So just one point which struck my mind is that we have been studying about the social problems in the India, the globe, and other countries. But when I just look into the after this COVID pandemic, I would say that there is a kind of social problem which is similar to all the countries. So when even Ilango sir said that alcoholic, we in Indian context we say alcoholic lovers. So now the situation is changing. The term is still alcohol lovers, right? And even of course, except the demographic factors and other social issues are the same, like the old age issue, the labor issues, as they were selling that the budgeting and debt counseling, because that is very important, because now people are almost, the socio-economic scenario is totally changed. Not only in Sweden, not only in India, the global scenario is changing. So therefore, we need to act upon how about the financial aid, because that is what the most of the country, because the GDP is being quite affected due to the economical situation. And how about the behavioral issues? Because the most important thing is that, which is being highlighted by the speakers, or the strengthening the hygienic factors. Because now I would see that many people are becoming more hygienic. So when compared to the pre-COVID situation, now people are becoming very hygienic in the practices, and of course a lot of things where the social workers should emulate from the last 2 days. So that is the message that they want to take up to their practice, because that is very important. It is not the board of, it's not just mere listening what the 2-day speaker or the reflections they gave, the strategies they give, and what kind of the social work intervention we are going to take. It is not alone that, and my thing is that how we are going to put into practice. So let us all join together as a social work fraternity in bringing about the changes in the social work profession. And I would wish to thank each one of us for joining this wonderful event, which has been watched or which has been lively seen by almost nearly 1,800 participants. So that is a very really wondering things, right? That is the support of the teamwork. Thus, I would say that the teamwork of the Department of Social Work, Bharathidasan University. That's why we are able to bring, so many people to join for this session. So I want to I would thank the senior professor, Dr. P. Ilango, Dr. Jirida, Dr. Nirmala, and Dr. Rajavet for really making this session, because we started with the first webinar. The last week, right? The week that on the the social work, right? So how we can able to the mental health perspective, and this is the second webinar. So I think that every week we are trying to have a busy schedule with the webinar. As yesterday, we were saying Zooming, where Abraham was referring to Zoom in and Zoom out, and as I said yesterday, we are Google Meet in and Meet out. So we are keep on meeting often. And I also should acknowledge the important work which is being rendered by my own the guest faculties, Dr. Suresh Kumar, Department of Social Work, who has been supporting us, and Dr. R. Karthikeyan, the guest faculty of Social Work Department, and Dr. Selvamani, a very vibrant and technical assistant of our department, who was doing very wonderful work, and the three important scholars, the young and the dynamic personalities of our department, John Milton, who is a PhD scholar, who is just right now an admin for this, and Leonie, who is able to give a good design of invitation, or what we call as an e-flyer, and Kumar Jodi. Right now, I think I would say that more than in a Google Meet, more people are watching through YouTube. So so all the technical people have done a very tremendous work for the successful of this for the 2 days webinar, international webinar, and I hope that was a really successful because and now it's over to the feedback, right? Now the important thing is that feedback has to be submitted for the certificates, right? So let me just give you a brief about the I think the Milton. Milton, are you there?
Hello.
Yeah, Milton, can you just tell about the nature of feedback?
Yes, sir. Thank you so much, sir.
Thank you so much, sir.
The participants, the feedback link has been provided in the chat box. You can fill in the feedback form, and more information on the e-certificates will be provided to you through email. Registered email ID which you fill in the feedback form.
Feedback form has
been provided in the chat box. We are asked to fill in the feedback forms through Google Forms, and more information on the e-certificates will be shared with the registered participants through email. Thank you.
So once again, I thank everyone taking part in this webinar. So for your continuous support, so thank you one and all. On behalf of our Bharathidasan University and the Department of Social Work, I thank each one of the participants. Thank you.
Thank you, sir. I thank
you,
Marie and Stina and Annette for joining us. Thank you so much.
Thank you very much.
I to thank all three of you, Dr. Murray, Dr. Annette, and Mrs. Stina. It is very nice seeing you after a long time. Thank you. Thank you.
It was nice seeing you too.
Yeah.
Thank you for giving us the opportunity to participate. We really appreciate.
Thank you, Dr. Maria. So thank you very much. That was a really interesting presentation from you. Thank you.
Thank you, Marie. Hello, Marie.
Thank you.
Thank you.
Yeah.
So I have to leave, but I hope that we can meet sometime physically in Trollhättan or in Trichy.
Yeah, of course.